So I'll be introducing Karen. Karen Perry is the Manager of Information Services of the East Brunswick Public Library and the founder of Just for the Health of It. Just for the Health of It began as a small public library program and has recently been awarded the New Jersey Health Association Award for promoting health in the community. And it's grown to a sizable program to teach people how to search for quality information on health. And that.
Wonderful stuff.
Good. Thank you.
Karen, and I'll just let Suzanne and Manu. Renu, I'm sorry. Renu introduce themselves as well.
Sure. Hi, I'm Suzanne Klein. I'm one of the consumer health librarians at the East Brunswick Public Library. My job is kind of split between two worlds because I'm mainly a youth services librarian, but I also do consumer health, mainly focused on children, teens, and families.
Hi, I'm Renu Singhal. I have worked for almost 18 years in the reference department at East Brunswick, and I'm also a healthcare librarian. And you know, that's a very new and I have to thank Karen for opening up that field for us, because you will be surprised at how often we get questions about things and people don't know. I mean, it's not just Googling everything, you know, it doesn't work like that. And then reliable, authentic information, which is very valuable, you know, and it helps our patrons. So part of my work is that.
Okay.
Karen.
Well, thank you, and thank you for this nice welcome. And I'm going to present today's talk like a story, because it really is a story. It started out as a personal story for me, and it grew into an initiative. So let me tell you what happened. In the early 2000s, my mother was diagnosed with a very rare form of a brain tumor. Something that, like, some crazy number like 3 people in every 100,000 get this sort of brain tumor. And before that, I had never dealt with the internet. I didn't know anything about how to find health information. You never know how desperate it is or how valuable health information becomes until you become what I call a patient on the internet. So here I was scouring the internet. I couldn't find anything. You know, you Google, you get all this stuff. It was a very rare brain tumor. And my mother then went and passed away, and right after that, my sister got diagnosed with breast cancer. She's a year older than me. So there I was again on the internet. This time I had the opposite problem. Too much. I didn't know, type in breast cancer. Oh my God, the whole world, all I did was how to Google information. So anyway, my sister got better, but the couple years went by, and things kind of lay low. And then our town, we started to notice a big demographic shift in our town. What was once a very, Caucasian neighborhood began to really culturally diversify. We had a lot of immigrants moving into the town, and the town was clearly changing. A lot of immigrants from Egypt, a lot of Christian Egyptians because of the turmoil in the Middle East. A lot of people from India, China, Russia. We have a big Russian community in East Brunswick. We also have from the Philippines. And we noticed, in addition to that our community was demographically getting older. East Brunswick is an aging community. People started coming to the reference desk. A lot of them had health questions. Where do I find this? The doctor says I have this. I always tell this story. We had a man, he was from Egypt. He came to the reference desk, and I still remember this. His eyes were like welled up with tears, and his 2-year-old had that H. pylori bacteria. She was in the hospital. She was being treated in the hospital. He didn't understand her condition. He needed health information that he could understand at his literacy level. So we started to see those kind of questions. Seniors coming in saying, they don't know how to use a computer, or they have arthritis, they can't hold a mouse. As people age, the normal aging process, even educated people, they get Parkinson's, they get, in terms of neurological, they get macular degeneration, which is very common, glaucoma, cataracts, things that make seeing a screen difficult or impossible, holding a mouse impossible. And in addition, they come in the library and they go, where are the reference books? And more was moving onto the internet then, and they were marginalized. They were left out because they didn't know how to use a computer. So between the people that were new immigrants that needed information they could understand, and many of our seniors, we started to see a pattern. And the pattern was that there is like a need for health information. So, right, it's like all the stars are aligned at that time. And I happened to, one day, sitting at my desk, and I see the New Jersey Hislop Hospital Libraries Association was giving a presentation by MD Anderson Cancer Institute. Have any of you heard of MD Anderson? We don't know about it in this part of the country. It's like our Sloan Kettering. It's actually #1 in the country, and Sloan Kettering is #2. They had a team of librarians coming up to speak to the medical hospital librarians about cancer resources. And since this was so, I had gone through this, I had said to my director at the time, you know what, I'd like to go and attend and see, what I could learn. And I have to say, it was a full day. I remember sitting next to a hospital librarian. She looked at me and she said, what are you doing here? And I said, we get a lot of health questions in the public library. And it's like, you do? But I was amazed at the wealth of health information that I learned. Not Google stuff, but like where to get the most up-to-date minute on, up to the minute almost, on cancer treatments, on drugs. I mean, a drug can be here today, and the next morning it could be pulled by the FDA. So, of course, books on drugs really are not relevant anymore. Books on disease. I mean, it is such a vast, research in cancer and Parkinson's and all these different diseases is so fast moving now. So I came back and I decided I would try, a little health initiative. I thought, let's try and just offer it up to the community. We didn't really know what we were doing, but I went to my director. She's like, oh, that sounds like a good idea. So we happen to have a television studio. Does any of you know we do TV? East Brunswick has its own television studio. So I summoned, and Renew was one of the people that participated. And I had staff from Egypt, who spoke, Arabic, Renew.
One of our colleagues spoke Gujarati, I spoke in Hindi. And
Aluna did
Russian.
I did English.
Yeah.
And
so we recorded a PSA, right?
Yeah, we did a little PSA on television. Like, you have a health question, come to the library, and our librarians would be happy to help you. This is a really grassroots program, and it's like the floodgates open. It's like people started, right, Renew? Coming to the library, asking questions.
And we don't diagnose for people based on symptoms. They come and say, I have this, what do you think it is? We don't know, and we don't claim anything like that. But if you have a diagnosis and you don't know what that is, sometimes doctors don't have time to tell you, or you forget to ask in more detail. So that's where we come in. We help you learn more about tests, or if you're going for a MRI, what is an MRI? What are they going to do in the MRI? I mean, there are people who just have no clue, and in a public library, you cater to all kinds of very savvy, from 0 to 100. On a scale, you have everybody on the spectrum, and so we don't diagnose for them, but we help them understand what they're facing.
So anyway, we started on, I decided started a health initiative. So I went down to our graphic artist, whose name was Jill at the time, And I said, I'd like a logo for our health because I wanted to try and market this. And I don't want it, I told her, I don't want it to look medically. I don't want it to seem like intimidating, like, very cold and, I wanted
Nothing clinical.
nothing clinical. I wanted a pink heart. I wanted it to be warm, because we are librarians and our passion is helping people. So she came up with this pink heart, a tagline just for the health of it. And Martha, who's actually not one of our health librarians, she came up with the tagline, the library's prescription for quality health and wellness information. So we started this little program, and that's me back in 2010 in the corner of the library. And we had a few newsletters. We built a little on that computer there. Oh, that's another computer. Since 2010, our technology's changed. But we built our own little intranet of some really good websites for health information that we were starting to aggregate and think, this is a really good one. Someone asks a drug question or a question about nutrition or we get a whole myriad of questions. So we put together this little intranet, and it was in the corner of the library. And we also that's me demonstrating, we started promoting it. And people started actually coming and asking us questions. And they started asking us questions and asking us questions and asking us questions. And it became very apparent very soon the questions were too difficult for us to answer. Because what was happening is that when you start promoting this, you really need research skills. It was not as easy as it looked. So I happened to be looking around on the internet, and I came across the National Network of Libraries of Medicine and their affiliate membership directory. So I signed myself up, the affiliate member, and I figured, we could get training, blah, blah, blah. And I got a call back the next day from a guy at Cornell Weill Medical School who managed the contract, and he said, thank you, for signing yourself up with your public library. And we got to talking, and it turns out that before you knew it, we started talking. I told him the things that we were doing, how we were helping, new immigrants, seniors, anyone who had any kind of health or wellness question. And he said, let me call my director, and the next I'll see if she'll let you in as an affiliate. You can't be a member because you're not a hospital library. You can be maybe affiliate as a public library. And he called back the next day, and we were actually admitted as an affiliate. And I still remember screaming in my office. I was so excited that, oh my God, and within maybe 3 weeks, he called me back, and he said, Karen, he said, because you're an affiliate member, you can apply for grants, and we have a grant in health literacy coming up. And I was like, oh, that's nice, but I never wrote a grant before. My boss, Mary Ellen, was on vacation, by the way, fabulous grant writer, and she taught me, that's what I'm saying, these are really important skills that you guys are going to take forward. But anyway, I wrote a grant, Mary Ellen taught me how to write it. We won $15,000 to create a health portal. And if you look on the brochure, we passed around, you'll see, and you guys can take a look at it on your own. It's www.wellings.org. And that became the basis or the premise of our whole program. Everything that we do, just for the health of it, is built on the training that our librarians get, that they add to Wellings. So what becoming an affiliate member of the National Libraries of Medicine did is it made our librarians transition from public librarians to highly skilled consumer health researchers. And they have to do that by getting certified to the National Library of Medicine. So I'm a big believer in ongoing lifelong training. I'm sure my staff can testify, because I really think that's what keeps everything invigorating. And the librarians, they can earn level 1 and level 2 consumer health information specialization. Hospital libraries have something very similar. I'm very proud that all our librarians, we have 5 health librarians, have to earn level 2. That means they have to take classes in, help me out here, teen health, senior health, children's health, drug information, mental health, refugee health.
Yeah.
My favorite was complementary and alternative medicine. That was my class one.
Yeah, I like that.
Alternative, I know teen health, and we have one.
I did one too that was called Super Searcher. That was really, it focused mainly on doing medical research, but it really was applicable to just being a librarian at large. I think it just made me a better librarian in general.
Same thing at all.
I think, and we each had, the way we did that, the website, WellLinks has categories of different types, and each one of us took up one category to add resources to that category. So if you visit the website, you will find lists of doctors. They're not just copied from the yellow pages. These are nicely, annotated and, relevant to what, like the support field has, mostly we try to concentrate on businesses in East Brunswick if you needed support, because it was a local program. But you'll find a lot of businesses listed which will provide support, doctors that provide health information, and all relevant sources to the database.
Yeah, so what we're new saying, we really subject specialize, and that's what that's for roots. Because that's what we did in corporate when I was corporate. But they, some of them, like when you said, they took, like Suzanne now, whenever she goes to a training class to National Library of Medicine, in order to maintain that certification, you need to take a certain number of credits every year to maintain it. They come back and they add those high-quality resources to our health portal. So there's nothing Googled, there's nothing guessed. There's, this is high-quality health information that has been vetted by the National Library of Medicine in all different areas that our librarians track. This is just a little editorial that ended up in 2010. And it's interesting because this is before the whole program really took off. An editor had written about this, and it really provides a glimpse of libraries' future. And really, the whole point of Just for the Health of it is a health literacy program. Does anyone want to take a try at defining health literacy?
I know we have people in here that will give it a shot, right?
What do you think it is?
The ability to comprehend information related to health topics.
Good. That's very good.
I think it's knowing where to search and how reliable it is.
That's like anybody else?
I think it's, you use the word literacy, right? So being able to get information and understand it.
Exactly.
Not
exactly.
just.
I think
Not
we
just
incorporate
obtain it.
all these.
You're all right. Actually, it's defined by the government as the ability to obtain, process, and understand health information in order to make informed decisions. And now they've added to that in order to affect behavior change. Because you can be health literate, but unless you change your behavior. Health literacy now is a booming area for the hospitals. The reason it's booming, and I sit now on the Healthier Middlesex Committee with both hospitals, and they've asked me to participate to represent public libraries. Hospitals are very concerned about keeping the cost of health care down. The Affordable Care Act, which is still with us, penalizes hospitals that end up readmitting patients within 30 days. So if a patient has diabetes, has a diabetic stroke, ends up in the hospital, they let the patient out, patient goes home, eats, ice cream and, whatever, all kinds of bags of candy, ends up back in the hospital, didn't take their insulin, doesn't know what insulin's for, doesn't know what happens to them if they don't take their insulin, ends up back in the hospital gets fined. And last year the hospitals were fined nationally billions of dollars. In fact, they publish it, it's public knowledge where every hospital gets fined. The future of healthcare, in fact, I spoke with Dr. Like at Robert Wood Johnson Medical School. He talks about what's called upstream, downstream medicine, front end, back end. Upstream and downstream means this. 15% of health, he said now, 15% of health happens in the doctor's office in the hospital. The other 80%, and that's the downstream. The other 85% is happening upstream, the back end, what they call population health, how people live, how their nutrition, their superstitions that, about their things that they eat, their neighborhoods, the safety of their neighborhoods, the access to fruits and vegetables, violence in their neighborhood, cultural barriers of certain cultures eat certain types of food. So there's a big emphasis now on population health. The hospitals are all talking about this, and they are looking at libraries now as major players in reducing health costs in the years going forward. And I said it's a big area right now, public health. And it's exciting that public libraries are really, public libraries are always seen, at least when I was a corporate librarian, these little places, very insular, and librarians just sat inside and did their thing, and that's not the case anymore. It's exciting that you guys will be able to go out and affect change. You will be able to make a real difference in the quality of people's lives by providing information. And what Just for the Health of It does is, like Renu said, we provide health information from the highest quality resources, but we take it a step further. That you had said about understanding. We deliver it, the package the information in a way that they can understand. The librarians learn in their training where to get translations of articles, human translations, with nothing machine translation. So if a patient comes in and they're Arabic or they're Indian and they need an article on breast cancer, on diabetes, I wouldn't want to have to read an article in a health article if I was sick in anything other than English. And that's the same with them. So the librarians are trained to deliver multilingual information, know where to go through their National Library Network training. They are trained to, just like a reference interview, evaluate, right, Renu? And you sit with the person, evaluate. What do they evaluate? Is English their first language? Okay.
And even literacy level.
Their literacy level. Okay. Do they have physical disabilities? We've had people come to the references. We've literally had to blow up the screen. They're educated people, but they have one lady is almost going blind from macular degeneration. So these people, or some of them don't know how to use the computers. A lot of seniors are being left marginalized. They don't know how to use a computer, or they can't use a computer. So it delivers the information and packages the information specifically so that that person can make an informed health decision, can take that information, read it, understand it, ask their doctor the right question, understand their condition, why it's important, what happens if they don't follow the doctor's regimen. And we also, like Renu was saying, we help people find providers. We have people call and say, we had one lady call. She wanted a doctor an orthopedic surgeon that spoke Arabic. So at that time Nadia was there, so she went through the whole Robert Wood Johnson roster of surgeons to find one, and called, and she did find one that had an Arabic name, and then called, sure enough, he spoke. but that's what we do. It's the added value, with the hope that when people have this valuable information, that they will change their behavior, and it will impact and positively improve that upstream medicine, so that they don't end up in the hospital with a stroke if they have hypertension, you know, or with a diabetes, or you know, or even people living with chronic conditions. We do have a lot of people with cancer. We have people with diabetes, and still we get the question all the time. I have type 2 diabetes. What should I eat? What should I eat? You know, if we had $1 for every, and type 2 diabetes is very complex. Anyone that's had any kind of experience with diabetes knows it's not like you just give someone a medication and it's done. It's changing. Insulin levels change throughout the day, and people have to monitor that. So they don't know. People don't ask questions. They say the average doctor visit is 15 minutes. So what happens to that person? Somebody, especially elderly people who are afraid of authority, a lot of immigrant people, new immigrants, they are uncomfortable, again, you know, intimidated by authority. They don't answer my questions.
And sometimes too, if you're upset that you received a new diagnosis, I think it's very difficult to take it to the next
process
step and think about what are my questions, because you're shocked and upset. One of the things that I like to do, kind of in like that hand-holding mode, is when I provide information to somebody, I also help them to develop the questions that they'll ask at their next visit.
Yeah, and recently Suzanne and I worked on a question together because somebody came to the library and said, my granddaughter is 3 and can you find something on depression in toddlers, right?
Yeah. And OCD.
And OCD.
Yeah.
Trust me, in a public library, no questions go unasked. You know, you can be sure that you will get whatever you can't think will be asked. So I found some stuff, and Suzanne found stuff, and actually at our library we have this questionnaire also, which helps us to troubleshoot if the question is passed on and not directly in our shift, and we are working on it. So that helps to write, and then we collect a packet and either we email it to people or mail it to them, so that they have complete handouts on everything that we found for them. So that's another thing we provide in our library, and it is really helpful for the patient and for us, because it clarifies a lot of things for us.
Exactly. And they found, it's funny because dealing with the hospitals, they talk about libraries. It's like, who would have ever thought? Like, I mean, I sit in go to these meetings with these people from this Healthier Middlesex committee, and who would have ever thought people are looking at public libraries? But they look at us, and there's a reason why they're looking at you. Because public libraries are in almost every community. People are comfortable, especially new immigrants, especially seniors. Even
a lot of parents.
Familiar, comfortable, friendly place.
And what they call, a comfortable, trustworthy. That's why we didn't want like Suzanne said, a clinical program. We wanted something for the public. So this is what we came out.
I have a question. So you got a $15,000 grant, and did you use that is welllinks.org your own website you developed, or is that a database that
No,
you
what happened is we
to?
used that money, we hired an outside web developer, and then since then I've written 2 more grants. One of the grants was to convert it to open source, and then a 3rd grant I wrote was specifically for marketing of the health portal.
And you all maintain it,
that was the beauty of
load the
open
resources
source.
onto it.
The first rendition of it, we had to have, it was a real hassle, we had to have a web developer. Every time like when we would find a new source that she learned about in one of her classes, and they'd come right back all the time, we got to add this to the health portal, it's a great resource, for diabetes, and then we'd have to call a web developer. It'd take like forever to get it.
But now you do it.
We all learned how to
add
resources.
And it's accessible by anyone in the public. You don't have to have a library
Yes, you can
card
go
number.
there.
And
But what Renee was talking about, there's an intake form. It's also online. We get our requests online, and also
like via email, people will
send we have an option. Do you want the stuff mailed or emailed, so whatever you check.
Yeah. So, but anyway, so this is just for the health fair, and I'm going to just show you pictures. We have it's turned into kind of morphed into an outreach project. What happened is,
Do you think it goes beyond the outreach and into community engagement? You spoke about, building a trust, and kind of there was a colloquium last week about community engagement, and they were talking about how engagement, grows trust between the community with the library. So it's a trusted place where people feel comfortable asking questions.
So in East Brunswick, we have a community day. So librarians go and spend 2 hours, 4 hours, 6 hours there. We take turns. So we used to have some sort of a quiz or some sort of something that would bring people to us. So if they got used to talking to us, then they would find us approachable and feel comfortable around.
I think that's a huge part of it. I know my piece of it, I do story times every week as well, and I think that kind of puts me into people's families. It gets my face familiar with them, and they are very comfortable divulging all kinds of personal things to me. And I think that there are a lot of questions that maybe we wouldn't get asked if it weren't for the fact that people feel like
I think
they know us already.
It really helps if you have a community day in the town to have a table from the library, and whatever. Think of something that you have a giveaway like bookmarks and
we did the sugar game last year.
Yeah.
Sugar game.
Yeah. Actually, Suzanne,
I developed the sugar game, so you could come to our table at our East Brunswick Day Fair, and you could take a card that showed like the Go-Gurt tubes that you might buy for your kid's lunchbox, and then you could convert that into granulated sugar, measure it out, and see it in the cup, which is horrifying to see how much sugar you're consuming when you have that can of Coke. Just as a way to kind of get people over to our table, do a fun activity, grab some of our brochures and information.
So we do. It has, like I said, it has morphed into an outreach program. And Robert Wood Johnson heard about our program and came to us and asked us 5 years ago, would we be interested in partnering with him as a grant? And would I want to write a grant to the hospital to present what we would do to advance community health? So this was very exciting for us, this little program, and it's a big hospital now. Keep in mind we're a single branch library, and we are now in our 5th year of the program. We are very excited. In fact, we're honoring Robert Wood this coming Wednesday night at a foundation event. The president of the hospital will be there. So you guys can see that health literacy is very important. And what we do for Robert Wood Johnson is we go out with the hospital. They pay us through the grant. Our librarians renew, Suzanne, we have other health librarians. And we go out. It's a health outreach visit. Looks like this, and that's our NAB. We're very proud to remember the National Library Event. So we make it very warm and friendly deliberately. Whatever holiday it is, we're librarians. We love to decorate. You'll find that out. It's like a little secret. But yeah, actually, I had a student from Philadelphia College of Pharmacy, and she took pictures when she came out to do her clinical work. And she had these pictures, and the professor was like, what are those? But anyway, that's Kathy. She's one of our health librarians. But again, we accompany the hospital, and we do our own outreach in East Brunswick without the hospital. But with the hospital, we go out to all kinds of events. We've spoken at Parkinson's support groups for people that were just diagnosed with Parkinson's disease, where our librarians will put together packets of information that people with Parkinson's and lower literacy level, and also they have physical problems too with Parkinson's, seeing things, so that they can see and understand. So we've done Parkinson's, we've done stroke events. Renew and I just did LGBTQ event for LGBTQ health that Robert Wood Johnson just opened up a clinic in Somerset. We've done multiple breast cancer events. We go out every week to their health and wellness centers. We focus on a topic. It could be nutrition, it could be diabetes, it could be mental health, it could be hypertension. We have a lot of fun. Every week the librarian Suzanne she'll talk a little bit about some of her programs. But here's Kathy. This is at an outreach event, and you can see we have a table. Last year we had 901 visits to our tables. And we had 286 people submit requests, medical requests to us. So the hospital counts every interaction, by the way, as a health literacy success. So if someone doesn't have to actually ask a question, it could be someone that comes up, and if Kathy has something on child obesity.
All right, I think the most asked question at the reference desk is, I have to go to this doctor, can you get me his school information, his degree information, where he went to medical school, when he graduated, is he board certified? So I think, we have the gamut of medical information that we can give.
And keep in mind, you don't need a grant to do this. I mean, we ended up with a grant with the hospital because in addition to doing this, like this that you're looking at, that's our own. That's not Robert Wood. I don't take pictures of Robert Wood because those are patients, but this is just staff. But you don't need a grant to do this. I tell every librarian, you need to leave the library. Our Suzanne and Renee do it all the time. They do it extremely well. Get out in your community. And if your community is having a fair, put together something, and I encourage librarians to become members of the National Libraries of Medicine. They are now very, very excited about including public libraries. And right now we have a number of New Jersey libraries that are signing up to become affiliate members. That affords libraries, you guys, free training and all these kinds of classes. You do need a little bit of training to do this. I mean, we don't Google things, but you guys can do that. And then wherever you land, you can do an event. Someone had mentioned they were interested in academic libraries. I'm friends with the librarian at Rutgers Medical School. She is into consumer health, very much into it now. The academics librarians are getting it. So everybody is excited about this. Find a way to do it. Go out in your community. Every town has fairs. They have things that are happening outside the building. So make sure you have a presence.
So you mentioned earlier that you take classes with teen health and refugees. Where do you take these classes?
Sure, they're actually provided through the National Network of Libraries of Medicine. They're all, actually I shouldn't say they're all online, I was about to say that. The majority of the classes I've taken have been online. Occasionally there are courses that are in person, but most of them just work kind of like a college class that you might take online. There's a Moodle that you log into. There are different modules that are open at different times. Most of them are self-paced. Sometimes there's something that happens in person, like a lecture or a chat. But for the most part, you're reading your work for that week, you're completing your assignments, you're interacting with other students online, and at the end of whatever it is, the 2 weeks, the 6 weeks, the 12 weeks, you've earned your credits for that one class.
And also, actually, we had two classes in person, right, last year.
Yeah.
We did mental health and refugee health, where the person from National Library of Medicine came to our library, and we, we took the course.
And then to get the certification is the Consumer Health Information Specialization, which is actually a certification through the Medical Library Association. But most of the coursework is really provided through the National Network of Libraries of Medicine. You have to have a certain number of credits for level 1, you have to have a certain number of credits for level 2, and you just need to continually take coursework to renew your certification every 3 years.
Yeah, I think it's very important for your director or whoever to have that vision that this is an area that is underserved, and that vision will take whoever wants to go with them too. You need someone with vision.
I'm going to pass this around. These are some handouts. I wanted to just give a couple of examples. Real handouts that our librarians have actually used. And when they do their outreach visit, whether it's a stroke event or we even have something here when we go to the. No, you can keep those. Yeah, you can keep them all. We have some here.
There's a lot of stuff in this folder.
If you guys read Spanish, we do when we go out to New Brunswick. Sometimes we sit outside the rehab center at Robert Wood Johnson, and we get a lot of people from the Hispanic community in New Brunswick. The hospitals are very aware that there's a real problem with child obesity, and with trying to create awareness among Hispanic populations. Again, this ties into population health. Certain cultures have certain incidents of certain disease prevalence. So we find articles in different languages. Again, these are human translations, whatever the scope of that particular event is. And our librarians, again, they're trained to find really quality information. Or it could be just like a fun thing, like a fair, you know, where you're like when we have the farmers market, we just do like a lot of fun stuff on the nutritional value of fruits and vegetables, and you know why different recipes. People like recipes.
Lots of nice recipes, and it's nice to know how many calories in 5 strawberries. You know, you never think about it.
I did get those questions, and I forgot to mention it. Just for example, but as also explained it as a pet health. We don't want to forget our furry friend. So, and actually, it's interesting because there's a National Library of Medicine has this huge network of veterinary school libraries. And one of my friend's dog was just diagnosed with a tumor, a cancerous tumor in its throat, and she had the name for it. So she called me up. She's like, Karen, you know, I was just all upset, devastated about her poodle. So I said, I don't really, you know, we don't do like pet cancer or stuff. That's like very special. So I called someone at National Library of Medicine. That's what it affords you, networks. And she sent out a message like nationwide to all of these veterinary libraries. And my friend was getting like resources, articles sent to her from all these librarians, you know, that specialize in animal health. So don't underestimate the value of networks, too. Because that's one of the nice things about the National Library of Medicine. It gives you a big network to draw upon. But anyway, so we'll move right along. There's Renew. What was this? Oh, this was the autism?
Robert Wood and Old Bridge.
Oh, okay, it was Old Bridge. And Renew does a lot of, Renew, tell them about your senior center.
I think once a month, we go to as a part of our outreach, we go to the senior center in East Brunswick. We take handouts for them on whatever topic that they have a speaker usually come in from one of the hospitals. So last week I had gone, yeah, it was last week. And they had somebody come and speak to them on mental health, and we usually get a list. And we go and I took some recipes, and sometimes some of them have grandchildren, so, some children's resources, health, and so all kinds of different things. You don't have to just concentrate on mental health because they hear enough of that, or they know enough of that. But sometimes, they'll come up to me and say, do you have anything on, my granddaughter's not eating well, so you have something on that I can give her, so.
And those types of events are often places where we end up getting a lot of questions that we bring back to the library.
Right, and then we can, and then we can also add to our collection if we find out we need, this is something people are asking about. And so we have a good health collection of books and articles, but our main forte is to find up-to-date information. But sometimes we have very current books on, something that is for people who want, different people want different resources. So we have books and then we do articles, and that's.
So I'll just take you through some of our outreach. Here's Ronald Johnson. There's Suzanne. This was at a homeless women's shelter, right, Suzanne? And tell them about the kind of articles you had picked out for that event, Suzanne.
I tried to bring a lot of things that reflect the questions I get frequently from parents about children. So I see I had some asthma, some ADHD, some nutrition resources. I also had some resources just about parenting in general, a few things about postpartum depression. But I would say probably the top 3 topics that I get asked about probably are just general development. People are concerned that their children may have speech delays or fine motor delays. I make a lot of people aware of the early intervention system in New Jersey. I get a lot of questions about ADHD and autism and asthma. So yeah, we had a lot of really a lot of chats with a lot of families at this event. Karen and I were there. Just tried to have a few fun things for the kids too, because a lot of children did tag along.
And it was funny because when we went to the hospital on this, and we thought, I had said to Suzanne, I really don't know, I figured like homeless women, a lot of them are going to be, not very literate. And we were shocked.
Yeah, they were great.
Questions
We got a lot of questions. Yep. We even got a question actually from one of the men who was there doing. Remember that? One of the phlebotomists who was doing the blood screenings. He actually gave us a question too. So you never know who may have a question. But we really connected with a lot of people there. It was kind of heartbreaking.
It was very rewarding.
But
too,
yeah,
you know, one lady, her son she was talking about how every time her son runs, he gets really out of breath. So we were able to find a doctor to help this woman's child. So, you know, you get a lot of those questions. Health is one of the few things you'll ever do as a librarian, and every single interaction is unique.
And they're all different. Yeah.
And they're all different. This was the LGBTQ that Rindu and I were at. This was, again, a hospital. There was a little hand grenades at the hospital in the U.S. This was this was the Parkinson's. Yeah, we've done, this is a hard one to swallow. We've done several of these with the hospital, and it is sad because these people were just diagnosed with Parkinson's. A lot of them are elderly. Parkinson's, more than enough, I want to know about it. It's degenerative. It always gets worse and worse. And you have to maintain a really upbeat and love. These people are so desperate. There's a real thing now with Parkinson's, with research, they're finding that when people are active, when they exercise and dance and bike and walk around, and that it actually slows down the progression and improves the quality of life. So when we go out, the hospital asks us, the librarians, to find articles about nutrition and exercise, the importance of exercise. So again, improving the quality of people's lives. This was this was just like some kind of nutritional thing we did. Oh, here's a little shot of our, you guys can look at it on your own, of our health portal. We have something called Leap and Bard. We've actually partnered now with the New Jersey Talking Book and Braille Center. Bard is actually, that's out. We'll come back to that. That's our partnership with St. Peter's too. In the library, measuring people's glucose and blood pressure.
We also have medical students, right?
This is actually. Let me go back just right here. I'm going to skip around a little bit. That's what I have here. This is we are one of a handful of libraries in New Jersey that participates in something called BARD and the Talking Book and Braille Center. They contacted me because they figured it would fall really well within what our library does, since we are so engaged in health. What BARD is it looks like a child's, you guys are way too young, looks like a child's old-fashioned tape recorder with big buttons. Big green button to go, red button to turn on. You can see the volume button. And what it is there are people that are losing their vision from age-related disease. Like I said, macular degeneration is very big. It's a big culprit in blindness. Diabetes, #1 cause of blindness in people. So if they qualify, and we have to certify them, they can get a player. It's provided by the federal government. We give them the player. And I have librarians, Kathy Damo, one of our librarians, she is trained to go into the National Library for the Blind website. They have a website where you can download digital books onto a little thumb drive. And these people, what happens, otherwise they would not be able to enjoy books because they can't see a book anymore. They're almost blind. Some of them are almost completely blind. And they keep the player at home, and they call us, and they'll say, Kathy, I just saw this novel, James Patterson just came out with a new novel, or whatever, and Kathy will go into the National Library for the Blind website, and because she has been trained to do that, download it on the little thumb drive and just mail the little thumb drive to the person. And we have had people literally in the hospital, their family members tell us until the day they died that lay there and they love this and then listen to the books. It's talking books. And it's nice because you can just hit start and stop. It's easy to see. It's designed specifically for that reason. And it brings the joy of reading to people who otherwise, because of blindness, would not be able to enjoy a book anymore. We just recently started another program just a couple of months ago called LEAP, which is for people over age 55. Doesn't have to be a disabled or a blind person. It's for anyone that has trouble seeing. And we're giving, what it is assisted. The iPads have assisted technology features. And a lady comes in and she's actually teaching people that, unlike Barb, that are like blind, clinically blind, how to use some of those assistive features. I know there's like the voiceover and the Zoom on iPads.
How to read the newspapers and how to read and play games.
And just so you guys know, one of my friends is a librarian at the National Library, at the Talking Book and Braille Center, and they work closely with the National Library for the Blind. They have tremendous resources for people that are blind. I mean, the libraries do a phenomenal job, and you guys have to sell all this because it's available to all our New Jersey residents.
And people who qualify receive this service for free.
It's all free, and they like we said, that this is free, but these people, otherwise they wouldn't be able to enjoy books anymore. Oh, and also the Library for the Blind has talking news, it has talking magazines. So the
funny thing about this device, I think, too, is we're also used to touch screens, but for somebody who can't see, it's really not navigable to use a touch screen. So you can actually feel where the buttons are in something like this, which is important.
So I'm going to skip that a little bit. So I'm going to talk a little bit about partnerships. I'm going to hand out a sheet here.
This is
Partners. Oh yeah, that's it. I asked one of our people at the library to print this up for me. I put together real quickly the other day a list of our community partners. Who was it that mentioned about the community?
That was Katrina.
Oh, yeah.
Yes. So that's your future, you guys. That's your future. Shows the community.
Nancy was on that panel, by the way, for that colloquium about community engagement.
Oh, okay. Well, that. I can't say it any stronger than, the partnerships that you cultivate as a librarian is going to make you, a real relevance to your community. And I think, in the end of the day, this all translates down to money, because when libraries are valuable, they're out in the community, they're seen, they're much less likely to cut your budget when they know that you're offering all kinds of services that are of extreme value. And it doesn't have to be health. I'm just going to go a little aside. One of my friends is down in South Jersey. She is passionate about business. She loves business. And she loves working with the business community. And she goes to, she goes to so many business organizations. There's so many of them. And she does something very similar. She does research for them. She helps them use, she buys targeted databases. She helps teach them how to use some of these resources. She speaks at their events. She has become a real leader in the business community. So I'm saying you can find your niche. Find something. I just heard recently that Newark Public Library is getting really engaged in homelessness, addressing the needs of the homeless and their health needs. And they partnered with Berkeley College, this is right across the street, to offer health screenings for homeless people. And I said to my friend at Berkeley College, I said, do they really come? I mean, I would have thought that they would be line enough. She goes, come, Karen, we had 75 people come, homeless people in Newark, to get their blood, they found out that they had, high blood pressure or diabetes. So there are ways. A lot of libraries are doing things with food pantries. The people most at risk right now are new immigrants, seniors. They have unique needs, but like Suzanne deals with parents. Parents are a whole group in of itself. They have a lot of concerns about children and health and development. And Renu can speak from the seniors. Seniors also have their own unique kinds of problems and questions. So you find your niche. You may decide you don't want to do health, you want to do something else, but you find your niche.
Yeah, I think that the philosophy of partnering in general really is applicable to any field that you go into, because an ideal partnership will be beneficial to both institutions. You both need each other in order to further your goals.
We got a call about 2 years ago from Regional Cancer Care Associates. They're throughout New Jersey. They're an oncology group, and they called me and they said, we'd like to partner with you. They had heard about our program through Dr. Robert Wood. And they wanted to see if they could do a program in the library called Managing Side Effects of Cancer for Cancer Patients. Well, we've always done like fun, feel good, We never went that deep in the weeds with people that were sick. And he said to me, it was Dr. Salwitz, he's a professor at medical school. He said, people with, he said, we do these programs now in the office in the basement, and it's very depressing. And we thought we'd try doing it in the library, where it would be very uplifting, out of the clinical environment. So I was like, yeah, why not? It's fine. So they organized a program. They actually hired a marketing company. They wanted more than just their own patients to come. We had a filled room. They brought in food that people going through chemotherapy could tolerate. Beautiful catered assortment of food for people with cancer. And it was so well received. And what was so wonderful is that afterwards, people sat with the doctor and asked questions. They did like what we're doing. They stood there, they talked, and then people came up and really were able to interact. It just really used the library in a way that we had never been used before. So from there, they contacted us, and you can see on your sheet, we've done cancer immunotherapy, we've done clinical trials, because people going through cancer treatment want to learn about clinical trials. What's new in lung cancer? What's new in breast cancer? We did one with Dr. Nissenblatt. Is cancer due to bad genes or bad luck? And we did a 6-week program on cancer survivorship for people that have just finished their cancer treatment that are transitioning from patient back into regular civilian. And then we've had other doctors call us. We've had we just did a program last year with a gastroenterologist called How to Talk to Your Doctor. It's actually really funny, Dr. Merkel. But people love it. They love bringing the doctors to the library. So we're doing this, and we got called by Rutgers Medical School, Dr. Light, who's one of their professors of family medicine, and asked Suzanne, Renu, and Kathy Sherman, another one of our health librarians, and myself to come and speak to the medical students about health literacy. Because again, they want the future doctors to know that libraries are places where they should be referring their patients. And they also want to instill in doctors that it is important that your patient is informed and that you do need to take time, explain things well, answer the questions. Let's go back here. And this is actually an event we did a couple of years ago with the medical school, where they came out to us, and we had actually done sections. What did we have? We had a table.
We had vaccines, I think,
vaccines, nutrition, diabetes, heart health, mental health. Yeah. And my team of librarians did the research with their National Library of Medicine training, found really good articles on all of those areas, and we had stations set up for the medical students to sit. They had to read the articles. It was was part of their assignment before they came. They read the articles that our librarians had researched, and they had to learn to present that information in what they call living room language.
I think the premise of this whole exercise was that the people who are in medical school need to learn how to speak to the average public who doesn't understand jargon. So and they need to be approachable. So I think it was a very good exercise.
It was.
Yeah.
And these two ladies here, one of them is now in a residency in OBGYN, the other one in oncology. But you can see here, they were learning about heart disease, and they got assigned a table. But it was really fun. It was an entire day. And again, showing the value of the library. Oh, these are students from the Ernst Marius School of Pharmacy. They came and they did a fun event, again, partnering with the community, and for the seniors on medication safety.
I've had them come out twice now to do family events as
Actually,
well,
this
and
is
they are
parents too.
fabulous.
I think half of it is seniors, right? So
That is parents, yeah. That was the first time they came out. I've had them come back twice. There are two different student organizations at the School of Pharmacy, and they both kind of have a prepackaged show they take out on the road, and they actually they play games with the kids. They have been wonderful, so much fun, and really the families have learned a lot too.
Suzanne, you want to talk about
That's one of
Turtle?
them, the Super Turtle. That's the American Pharmacists Association student chapter at Rutgers. They just came out last spring, and I was actually just talking with Obama, who was their president last year, getting to a contact person for this year, because I'd like to have them come back. But they set up, I think, 5 stations throughout the room, and they had families kind of progress through. The kids played all different kinds of games. They had a craft for them. They had information for the parents. It was, of course, they had freebies too. They had little special measuring spoons to give out for your Tylenol. But people left with a lot of information, so it was great. A lot of fun.
We have, again, this is our brochure. This is a little thing on marketing. I just wanted an example. We put our logo, just for the alphabet on everything. Again, marketing, just for the alphabet. This was Philadelphia College of Pharmacy. They actually came out, they heard about us, and they had to do some community service, and they asked, similar to the Rutgers, if they could do something talking about the Braille stuff. Oh, this is one of our Barb customers, and she was delighted to have her picture taken. and that's Mary from the Talking Book and Braille Center, and she's giving her a Barb player, showing her how to use it. This lady obviously qualifies for Barb, and that's Barb. This is an ophthalmologist that came out and talked about I love Dr. Lightman. Dr. Lightman. He's a character. But he came out and he talked about macular degeneration. Drew a big eyeball there. Talked in layman's terms so people could understand. Just to give you a little flavor, this is this Dr. Fang. He's a medical oncologist talking about cancer immunotherapy. He's trying to explain in very low language the immune system and how the immune system can be put to work to fight cancer. So again, you can see some of the partnerships. This is the Robert Wood Johnson and St. Peter's. Because of my work, I participate on the Healthier Middlesex. The hospitals were actually awarded this for innovation. It's an outreach award from the New Jersey Hospital Association, outside the box, partnering with local libraries to increase community health literacy. And again, here it talks about the award and talks about us at the bottom, that we were an inspiration. Here we are with all the people from the hospital. And there is Suzanne. There, we were just featured in a symposium of both hospitals to improve community health through health literacy. And Suzanne, want to say a little bit about the panel?
Sure. So the panel was talking mostly about active partnerships. So I was talking about how I kind of think I have 2 different types of partnerships. I have a couple of partners that I work with continually throughout the year. I'm working right now with the Central Jersey Family Health Consortium. I had met their director actually at medical school that day, and she focuses mainly on maternal, infant, and early childhood health care. So they have community health workers, people who generally have a degree in public health, and their goal really is to go out into the community, find people who need help in some way, who need support, who need health resources, who need health care, who need assessments, anything, and then help them to receive that care. So we Laura and I had talked about ways that we might be able to work together, and she said she'd like to maybe have some community health workers come out to the library on a regular basis just to present information in a really low-key, friendly kind of way, and it kind of allows us to present a program monthly to people who come into the library, and it gives them a way to kind of get that inlet into the community and make some connections with people. So they have come out, let's say, maybe 5 times so far. They've talked about developmental milestones 1 month. They talked about nutrition and healthy habits 1 month. They did a discipline program 1 month. They did bullying prevention just this past week. And they're doing diabetes awareness in November. And they're doing a hand washing workshop in December because it's part of their flu prevention protocol, actually. So I just work with them every month to come up with a topic that we think will be well received and to schedule a time that will be good for families. I also work with a company called Fablefy, which is a startup company that's based in our town. I met their founder actually on the floor of the library, so I definitely will second what Karen said. You never know where a partnership might grow from. You never know when you're going to meet somebody who's going to kind of be on the same page as you are. So Shilpi is my new friend who runs this company that's all about teaching mindfulness, meditation, and emotional emotional control techniques to children and families. So we started out, she kind of came to the library, did a little dog and pony show for me to talk about what she usually does. Mainly she works with schools, elementary schools, junior highs, high schools, and daycares and preschools. And she typically does something like a 6-week workshop once a week. So I didn't really think, for our purposes, that would work so well. It's very difficult for us to get the same people to come back week after week in the public library. So we decided instead just to kind of break it down into different age groups. And she's been coming once a month, either she or one of the staff members from the company. And they're just doing like short programs. They do a parent-child program in the early morning once a month. She's been doing after-school or evening or weekend programs for, for kindergarten through 3rd grade, 4th grade through 7th grade, and then teenagers broken out separately. And it's actually been it's been pretty successful.
And that's the pediatric dentist.
So the pediatric dentist. I like to have the pediatric dentist come because typically we get a good turnout for that. But I hadn't had one come in a couple of years. And then I would say maybe in July I ran to Target on my lunch break. I was standing in line. And who is in line behind me but Trish, the dental hygienist from the office of the dentist who had previously come to the library. So we started talking and, kind of talked about how they had a new dentist in their office and she'd love to come out and do something. So I said, okay, great, well, we'll have to set something up. So the most recent actual medical professional who has visited our department is the result of my lunchtime chat with Trish, the dental hygienist. But in the past, I've worked with so many other groups or individuals. For a while, I really worked closely with the St. Peter's Speakers Bureau. They were great about just getting somebody to come to the library like every 2 months or so. And I had everybody from like an infant massage specialist to a dermatologist. I had a lactation consultant come from them. I'd also really encourage you to kind of think outside the box. So people who are maybe not traditional speakers sometimes are really happy to come out and do something. There was a time I wanted to do a water safety program right before summer started because I thought that would be a relevant topic for families. So I called up the director of the Aquatic Center in East Brunswick, and he came out and did a great presentation and brought all kinds of fun stuff for families to play with too. I've also hit up the rescue squad, so I thought, first aid, just general first aid, not CPR, but just, I get a lot of questions about when it's should you call the doctor or should you call 911? Or is it something that can be handled at home? And the rescue squad, they were totally fabulous. And they're really, I think part of the reason they were so great is because they're volunteers in East Brunswick. We have a volunteer rescue squad. There are people who really feel very passionately about what it is that they do on the squad. And so they were so happy to have the opportunity to come out and deliver their message. And I think the biggest takeaway for parents, I've had them back twice actually, I think the biggest takeaway for parents is that don't hesitate. If you're concerned, call 911. And I think just hearing that from somebody who's an EMT was really valuable for people to hear. I've also worked with the local school district. I've had special education teachers or school nurses come out.
Suzanne also was asked to put together in Spanish for them.
Yes.
About
so that was for their Puerto Rican Action Board. In New Brunswick, they have a Family Success Center, and they do a parenting program, I think once a month.
So
I
mostly
still
new
haven't made it
immigrants.
down there. Karen has actually gone there for some events. But generally, their program is all in Spanish when they do the parenting programs. So I've actually been providing information for them, just putting together like little stacks of articles. And one of the things that we've learned in some of our consumer health information specialization classes is how to assess information and find information in languages that we don't actually speak. So I've been able to find information for them on mental health, on diabetes, on nutrition, some of the other topics they've covered, and make sure that what I'm giving them is something that I think is on a reading level that they'll be able to understand, and all in Spanish.
So you never know. And Suzanne is totally right. Definitely tap your community. I got a call from a physical therapist and he wanted to do a program. And I said, well, what do you want your program to be on? And he said, well, really, anything you want. And I'm like, oh. And he just said, well, who would the program be for? And I said, well, probably seniors. And he said, and he asked me, he said, well, what are the kind of things seniors like to do? And I said, well, they love to garden. So he said, oh, well, I'll come and I'll do a program on gardening, on how to prevent back problems in gardening. And then we had another physical therapist come, and they did a program for seniors. Again, this is the other spectrum. Suzanne does the other on balance. And they did balance assessments to see which seniors were at risk for falls. So again, like Suzanne talked about, going out in your community, making those, that's why you're not going to do it in a library. You're going to have to go out, talk to people, make sure your library has a library table at your town fair or municipal events. Suzanne has gone out to back to school nights.
Yeah, I've done like school health fairs in the evening.
Remember we went once to...
Yeah, we went to Central School. Yeah, that's right. We came with that.
Yeah, back to school nights. We had a table on one of the back to school nights.
Yeah, I've done a lot of those.
Or a Halloween program or something, anything.
I think if I have like one piece of advice really about finding partners, it would just be to be friendly, like wherever you are, because you never know who you're chatting with.
Get you everywhere.
Yeah. Did you have a question?
I did. So it sounds like you have a lot of really fantastic programs, and I work in a public library, but one of our biggest fears is that people aren't going to come to the programs. All of your programs well attended, and what time of day do you usually have them? Because a lot of our problem with programming for the nighttime is that we have less staff.
Yeah.
And so that's why all of our children's programs are in the morning, all our story times are in the morning. So what time generally are your programs, and also are they well attended?
Most of the programs that I do for either the parent-child or the preschool programs, they're usually 10:30 in the morning on a weekday. As a working mom, I say that kills me because I know that eliminates other people who are just like me, but it tends to be the best attended. Not everything is well attended. I will say, the anti-bullying or the bullying prevention program last week, it was not so hot. Partly, I think the weather is a very big competitor when it comes to programming for families. If it's beautiful out, you're just going to have lower attendance. If it's pouring out, you're going to have lower attendance. It has to just be just right outside. You won't want to play outside. It's not starting to
dance then again you'll have lower attendance. And we've had that for some of our programs.
Yeah, you have to think of that. I always tell, our health programs, I kind of tell people, stop 2 weeks before Thanksgiving. Because people just don't come out until after Christmas. And then even then, in the January, February, March, we go kind of light because the weather is iffy. And then April, it really picks up.
Nobody wants to drive in the dark. Many people don't like driving in the dark. So you run a gamut, but you get a reasonable, it's not like 100 people, but you'll get some. I think the marketing of the programs is very important. If you have registration requirements so that you know who is coming or how many people have registered, it helps.
I've done the mindfulness for families at 11 o'clock in the morning on a Saturday. That's been pretty good. That's a good time for us.
I have a question about the mindfulness. I started a mindfulness program for toddlers in our library, like a mindfulness yoga story time.
Yeah.
And we were thinking about expanding that part of it to teens, because we have a lot of stress management questions and things like that. So what kind of things have you done for teens?
I'm actually not the teen services person.
Okay.
So you might want to talk to
Yeah.
Jessica. They are a tough sell a lot of the time. They
Yeah.
really, really are. It just depends on, I think, school stress levels, volunteering.
They have so much on their plate.
Yeah.
That's so
It's half the
bad for
problem now.
teenagers. So much stress on them.
I think the best attended like stress busting thing that we've done recently for teens has been the Bob Ross Paint Along program.
Oh, that's really cool.
You know, it's just like a chill way for them to kind of relax after taking the SATs.
I was going to say timing too for seniors. We know that elderly people don't come out at night for programs.
Yeah.
I have a question about the marketing. You're doing marketing for the programs. Are you going outside of the library, promoting within the community, putting flyers up?
We promote them.
Talking it up when you're at
Social
community
media.
events?
We do
have a social media.
We do targeted social media, targeted Facebook. We also, Instagram. We advertise on our library website. We advertise on our health portal. When we do our outreach visits, we bring flyers.
And we also tried an ad because we have a cable station for the township within the library. So we sometimes use that.
That's a good opportunity to get people who aren't usually coming in the library.
At least you need to get the word out.
Yeah.
So I do teen services at my library, and actually recently I've been trying to start kind of like a health and wellness thing going on. I've done a couple of I've done like dating violence awareness programs. I've tried to do some basic like stress management programs, but I haven't been getting super great attendance, mostly because teens. But if you guys go to the schools at all, I don't know if you do, but how do you kind of advertise that?
I haven't gone to the school for the specific program, but when they've been having an event, I think if you can have if you can get into a school event somehow, and I've had success at like school health fairs or back to school
Actually,
events,
maybe talk to the guidance counselor. Maybe they can give you some idea of what would be accessible for.
The other thing too, we just bought a database called Tutor.com. Is anybody familiar with that?
Tutor.com.
It's not a health database. It's a great database where you can actually between 3 o'clock and 10 o'clock at night, every 7 days a week, you can actually log on and actually interact with a live tutor. These tutors that are specialists in all different areas. And we paid a lot of money for it, so we really want to make sure that we get good usage. So I did send it to my friend Cindy Collins, and she's the media specialist at East Brunswick High School. Again, we reached out to them years ago. We have a really good, our library, really good working relationship with your schools. Make sure that you know your schools and they know what you have and you know what they have. And Cindy did take on Tutor.com and she sent it out to all the teachers electronically. She put it in their school newspaper for the students. So if you get those, that's the high school. I'm not talking about the elementary school. But we do have our librarian Aaron that does also with Suzanne go out to the schools to promote a lot of library resources. So again, getting out of the building is the most important thing you're going to do to create new relationships and to really give value to your profession.
Do you find that other teen services events are well attended, or is it?
It depends. Over the summer notwithstanding. I have teens that I have a group of teens that kind of know me who come in to either volunteer or come in regularly for I host game nights, and they'll come in for that, and sometimes they'll show up for some of my programs. But otherwise, I've had to contact the librarians at the school, some of the flyers that I've made. I have gone into the school before and talked about summer reading. We talk about programs that we're doing then. So occasionally I'll get some teens that see it either through school or something and come. But most of the time it's really just a crowd.
Do you have a teen advisory group?
I've been trying to start one for about a year.
I wonder if you could advertise it, because teen students are always looking for volunteer experience for college.
We offer like 2 hours a week of volunteer service, and a lot of teens do that, but I found that no teen really wants to spend a night in the library talking about what they can do for the library. They just kind of want to come in and stack some books. So
Yeah, we have something too called the Geek League in our library, where teens volunteer to help. They have certain designated hours. We just have like a table, and people drop in with their mobile phone or iPad or mobile device, and they again, they need to do this for college.
yeah.
So that's another way to get
That's
teens form a Geek League.
Yeah, we have a large elderly population too, because we're right next to a retirement home. So that would actually be really great for that.
And you
even I don't understand my iPhone so many times. I mean, I could do with a lot of help if I came along. So, and there's a real big demand. I mean, they're always asking us for flyers of what time and when are these kids going to be available.
If you're next to a retirement home, I would make sure your library, and I could talk to you afterwards, becomes an affiliate. Or what library is it?
Somerville Public Library.
Oh, I think you are affiliate members.
We might be.
Are you you're not trained, are you? So maybe you should, because that retirement home, you should be there. It's right across the street from you.
I know the adult services librarian goes over there.
But if you're interested in health, you will get a abundance of questions if you go over. You can set up a table.
Yeah.
Do a fun table. Just do something on like healthy recipes. Something fun to draw them over. And go over there, and then you will be amazed. They'll start at, advertise it if they have a question, and you'll get questions. Any other?
Are you through your slides, Karen?
I am.
Okay.
Thank you, Paul.
I wondered if, because there are obviously, based on the questions, there are students here who are interested in working in libraries, but there are other students who are more into data analytics, user experience. They're in other areas of information science, and I wondered if you could speak to, around the topic of innovation. Obviously, you started in one place, and it's here, and who knows where it's going. But what are the kind of tips that you can offer for students who might run into roadblocks at their place of employment about, with the excuses like, well, we don't do that here, or that sounds a little bit unusual, or how do you get around through those kinds of barriers that we've probably all seen or heard about in terms of starting or forming partnerships that organizations might not have had before, starting initiatives that might not have ever existed. Based on your experience with this, how do you get through those kinds of barriers?
In the community, not other libraries. In the community.
Not just libraries, but just in general.
I think that it starts with going out. It starts with the human interaction, the personal interaction, with getting to know people. And, I think a lot of it is a sales approach. I mean, I know that may sound, maybe that's not the answer you're looking for, but, you need to know what you have. You need to be confident about what you have. And you need to be able to articulate what you have and how it can help them. And I have to be honest with you, Charlie, we go out, we have more people calling us, and we've had to turn people away. It's like crazy. People really are looking, especially nonprofit organizations, because they don't have the resources. They're really looking for community partners.
Add to what Karen said, I would say to keep some statistics, because what ends up happening is if you can go and broach it to your boss, if you say we had 35 questions on this last month. So some sort of statistics,
We do. We track because we have a grant with the hospital, plus our own library. We track every request. We don't track the person that asked us for HIPAA reasons, privacy, but we track every request, the subject nature of the request, and also the amount of time that was spent on that request. And we also track the number of people that come to our tables at an outreach event, because the hospital counts every person that comes and picks up a paper is an enlightenment. a person has now learned something more than they knew before. So we track what we call tabling and research requests, and the number and the amount of time we spend on each request. And last year, like I said, we had 901 visits to our table. We answered 286 reference questions that people asked us, and we spent 176.75 hours on librarians doing research. So yes, we do. And when you get a grant, which you all, I hope will get, that's another thing. The grants, you need to bring in money from other resources because libraries can't go it alone. But when you do with grants, you will have to track everything because you have to do reporting on grants. So yes, those metrics are really important. And again, that's a sales thing too, you know. I mean, we've had people come to the library, like the assemblywoman, the councilman, the mayor, and they come and they ask about it. We'll say, oh, can I have a tour? Tell me about your health. Tell me, or it doesn't even have to be health. It could be, they'll go down and visit the youth services. And that's your opportunity to get in front of those people and really market yourself. Because those mayors talk to other people. And they get together at business organization. We have business breakfast once a month in the library. The mayor's there and like 50 companies. And that's a good way for other companies to know that, the mayor really supports the library, so I'm going to support the library too. But I'm telling you, nonprofits, they love partnering with the library. And, we don't really do anything with real profit businesses. We don't do anything.
And because we are not.
Because we're non-profit. In fact, we don't use any resources that have, like WebMD. We never use WebMD. The person they teach you right in your classes never use WebMD because they take advertisements. So we're very careful of that.
Why did you go from the initial website design to open source? What did that do for you? And for those people in the room that are more technical, what can you teach them about how to develop and work with, develop tools that might be more usable, more customer-centric, if you will, in terms of just websites?
Well, the way we do, I think we had talked a little bit about this in the beginning. The initial website, we had to rely on a developer. Mm-hmm. And that was a real hassle because the developer was off-site, and we didn't feel like we had a very collaborative working relationship. And that's when I wrote the grant for open source. I didn't know what open source was. Our IT people were like, oh yeah, I'll teach you, Karen, I'll teach all your staff. And so we wrote the grant, we awarded the grant, and we hired another web developer to create this open source. And what that does now is our librarians are able to go in and to make changes whenever they take their training. They go into their respective category that they monitor, like Suzanne does children health, Louis does adult drugs, and they add to the health score. I don't know if that's answering the question.
What was the difference between the initial developer? You said you weren't connected to them, they were off-site. What was the difference between that experience and the experience with the open source developer?
How for the librarian or for the...
For you, how was that different as the customer of those services?
No, I don't think they saw anything different.
We were the customers. You mean.
Right,
for
as
us.
the customer.
Yeah.
Because some of these people in here will be developing systems.
We had the web developer, the first web developer. We had our IT. We were working through our IT department so we were not. I was not working with the developer, picking up the phone, going, "Hey, I want you to do this." Plus, we were working with our IT department, and they were communicating with the web developer, and they did not have a good relationship with the web developer.
Because?
That I don't know.
Okay.
There was a lot of undercurrent, and they really wanted to break free. So when we won the grant, the second grant to go open source, our IT people said, Karen, let's not use them, let's just use another web developer, and we used somebody else who specialized in open source.
Sometimes it's a financial problem also for the library.
How so?
have an extra database
Oh.
and I don't know, but maybe that could be a reason that they have a contract for the library's website, but then this would be extra for them.
Oh, so the same people that developed the library website did your site?
Yeah, but
Oh,
the open source one.
Initially.
okay.
I will say too, I think the current developer who has done the open source site for us, he's just very, very easy to work with.
Yeah.
And I think it's just kind of like an interpersonal communication
Accessible,
thing.
that's the word.
Just very nice.
He met with us. In fact, we had to have several training sessions, the librarians. And
I mean, and we can shoot him a question any time of the day or the night, and
he answered it.
right
but
back.
then an hour we'll get a reply.
But he
back.
did sit with the staff. We had several hours of training where he brought my staff in after the library closed, right? We sat and he went step by step. This is
Many
what
times.
open source is.
Many
This is how you add things. This is how you create banners. This is how you add things on the side.
And I think also he knows that we need him to be there for us, but otherwise he's very hands off. So
Yeah.
it's just like when we have a problem, we email Yuri, that he comes in.
Yeah.
Otherwise, we can change the architecture on the site. We can make any modifications on our own. And then when we get stuck or we get an error message, then we drop them on.
It was a little concerning to me because we're not tech people, librarians, and all of a sudden I was a little worried when Yuri had come to me and said we should have, I really think we should create an open source. Open what? But I was worried about it, but he really did a phenomenal job, and I think it is a testimonial to the fact that he really has incredible interpersonal skills. He's responsive, like Suzanne said. You have a question, and by the way, he is a full-time, he works for us.
He works for Rutgers.
He works for Rutgers full-time. He works for the library part-time, but he has his own web developing business too, that we paid separately. But he really, he'll answer you. His responsiveness is admirable. His ability to work with people, not make the staff feel stupid, to train us. I mean, we had several intensive trainings, and he started small, and then he got into more.
None of us understands how to do this, so he was very slow with us. But
Yeah.
we learned.
He's very methodical. He's a good teacher.
But that's what made him, and I'll tell you, and it's another example, if people don't like the web developer, they fire them, We just were like, you know what, we're just not dealing with it. And actually, the web developer that did our health portal had done our website. They were unhappy on all levels, the library website and the health portal. That's why when we went open source, we went with Yuri for both website and went to our web developer that we liked. Any other?
I have a question. So, sometimes in public libraries there are boundary problems between patrons, and also when you're providing reference on something like health or legal services, sometimes you can feel uncomfortable giving certain advice because you're not a law professional, you're not a health professional. So how do you manage those boundaries, and also have you encountered situations in which you felt uncomfortable?
Yeah, well, first of all, health information is private. So
Yeah.
number one, all of our health research is done off desk. And we did consult a lawyer. We do have, once you go into custom health research, where you are trained and you advertise, deliberately advertise your service, you need to make sure you consult with your library lawyer. They do write a disclaimer. You will see the disclaimer on our health portal that it is not medical advice. We never diagnose symptoms of people. We don't ever use symptoms checkers. We have had people. When you do start offering health reference, you will get people that will come in and say, I have this on my own. And we're like, we'll help you. I had a lady, it's like, you know what, I'll help you find a doctor. That's what we do. And we tell people, we'll help you understand your condition once you have a valid diagnosis. But we don't ever diagnose things. And we shred everything once we are done with the request, and we keep metrics, but we don't keep patron names.
And also the disclaimer, if somebody asks for information on via email, the disclaimer goes on every email that we send also that, that this is advice only, this is not to replace a medical.
We also make sure to have conversations with people if they come into the library to ask a question away from anybody else. So if it's busy or if there are other colleagues at the desk, we just make sure to step away with the person so that we can have a private conversation.
Yeah, I mean, I mean, you will get people who will come right up. Some people have no shame. You know what? I was just diagnosed with type 2 diabetes. But you're like, you know what? Let's just take this off desk and go someplace. And I do have, Suzanne works privately and Renew, and they work on the requests, and then we have a desk in the back off the reference desk where we do our health research. Yes, it is you do have to be respectful. It's very sensitive information for some people, especially
they're embarrassed about to ask certain questions.
So just out of curiosity, what do you do with a medical condition where they've been to several doctors but they can't get a diagnosis?
Yes.
Like say migraines or something. How would you deal with that?
So there's nothing we can do. If the doctors can't figure it out, that's, so we tell them. I've had one person come up to me and she went to 4 doctors with the same condition and none of them could figure out. So all of them ordered 4 sets of tests and 4 sets of MRIs or whatever, and because nobody wants to use someone else's documents, right? Everybody has to have their own. And I told her, I said, I'm really sorry you're suffering so hard, but I can't, I couldn't tell her what to do. She said finally she went to somebody in UPenn, and I could get her the name of the doctor and his phone number, office phone number, but that was it.
We had another person that was upset too. She wrote me this long letter because she didn't like what the librarian gave her, because she had seen on TV about those spinal surgeries where they do that 1-inch incision and then you're out walking like the same day. Remember the next day he's playing golf, I think. And then, she wanted to know that versus like major open spine surgery.
I remember that.
And which one, and which one.
Yes, I remember that.
So we don't, we don't do that. We give you information about both so that you can read it,
we can't
make
decide
an
for you.
informed decision.
But that's the thing with health literacy is that you're supposed to take the information and make your own decision.
Yeah, we can't decide for anybody.
Yeah, but you will get that.
That's way beyond our pay grade.
Yeah. And we've had other things too. We had one person going through cancer treatment that was going to be undergoing radiation of her tongue. So we, through our NNLM training, I was able to help her to get the best. There's really good places that librarians learn about radiation, side effects of radiation. So those are all things that you can never Google. You would have to be specially trained. So again, this is if you ever embark on this, just make sure you get that National Library Medicine training. You don't have to become certified level 2. You can stop at level 1, but make sure you have some, because like Suzanne said, you're really trained to evaluate information in addition to just the first and final report.
Yeah.
So you mentioned how your community is kind of a senior community and people come in are seniors and they walk up to the references. But I'm just wondering how you market to young adults who are more comfortable with Google and WebMD, like you said. But how do you actually market to them and how do you make them come to the library?
For health or
Yes, for health information.
We don't. Well, we have the health portal. The health portal has the teen links on it.
When you say young adults, you mean
Yeah.
more like
More,
20s,
yeah,
30s,
like
40s?
probably
Okay.
people who have just like 20 to 30s maybe.
Okay.
Yeah.
I thought that.
Well, I think we probably do more marketing just in general through other types of programming. We have the Adult Services Department in our library does do programming specifically for those age groups. They try to come up with cool, trendy things that younger adults might like to do.
Also, they have
get them in the building.
and they have a much lower need for healthcare in general, because largely that is a demographic that is largely healthy. right? So until you need to look for information, you will not come to look for it, I mean, so we wait for people, I mean, unless
It's true though, because
you have to wait, like, unless it's diabetes or something more chronic, that's a different thing, but something has to precipitate your need for information.
It's like they say, people go use libraries, up until like high school, in case they have to, unless, schools force them. Then they kind of fade away in their 30s until they have kids, and then they come back as parents.
Yeah.
So that's a whole
It's interesting too, because you keep hearing also about the Affordable Care Act. That's the demographic that kind of makes it affordable for everybody else, right?
Yeah.
So I think that kind of seconds what you're saying about that kind of being a general healthier age.
They have fewer chronic problems, I mean, they don't start that early.
And they do have, there's a lot of sexuality things with teens and young adults. And I know Jess, our teen librarian, I've given her stuff to post on the teen website. I don't know, honestly, what they do with the information. She does post it. But you know what? It's nice that they see it. That they see, suicide is a big problem in young adults. That's an area that libraries can work, to create more, awareness. So there are issues. It's how to reach them, and you have to that's the kind of cohort you have to reach where they are, because they're not going to come to you. It could mean going out to places where teens gather, to websites,
The library,
teen websites.
this is for a slightly older demographic, but the library actually does a monthly, book kind of conversation group at a bar in East Brunswick every month, just for the 20 and 30 somethings, just to try to reach people, because they're not actively using the library, but they're still interested in being engaged in a way that they would traditionally be engaged in a library.
Until
This
they
way
become
can-
parents. When they become parents, they come back to see them again. My wife has children. So,
I just have a question for you before we wrap up, and thanks for sharing your insights. We have students here who are in various stages of the master's program who have different interests, and one of the themes, I guess, that I have encouraged students to think about is to do assignments and create assignments for that are going to be beneficial to them down the road, which can be very hard to predict. So you all are various years away from your master's program. Would you, in the context to talk to students who are within the master's program now, as you reflect on the time and the different career, your different, perhaps careers, different roles you've had, what kind of advice would you give a master's student now in the room about skills or relationships or networks that are important, that have been really helpful to you as you've moved in your career, and things that they could think about now?
number one is marketing. That's really, I see that as a really important element of the future of librarianship. My advice would be to enjoy people and enjoy getting out and talking to people, and don't be afraid. Don't be afraid to sell. I always felt that librarians were very apologetic. They tended to not sell themselves well, and the profession is now, people, like I said, the hospitals are looking at us as ways to save money, to drive down costs. So I think that's important. I think grant writing, you all need to take classes, except maybe the web developer people, but even you guys actually, everyone could use extra money. So that's an important skill.
Graphic design, which I would guess you guys probably are good at, but that wasn't anything that I ever learned in a formal way, but I used it at work all the time, really, really all the time. So just get some basics on that, I would say.
I think the only thing I could add to all this was to be affable personally and available. That really goes a long way in building relationships in the institution you work for, and that helps everybody, the institution and yourself.
Are most of you required to do some kind of field experience? Is that required?
Recommended.
Yeah. Definitely.
Thank you.
I felt like I learned so much just through internships, because I think that sometimes you're learning something on a very philosophical level in school, but until you put it into practice, it doesn't quite click.
Cool. Do you have a question?
So, yeah, I have one more question. Based on said hospitals have come to you guys to basically, they give valued information to get from the communities and the patients. So I was wondering, out of all the information you gathered, the data you collected, are you then able to see any trends or patterns in health problems within the communities that would possibly help you better allocate resources to your research?
Yeah, it's actually, that's a good question. Because we do gather the data, the hospital and the grant, they actually have been designing programs around things that, the questions that we get. So every month we send them the questions, and they look at the questions, and then they design some kind of program.
A big one is diabetes, because it's such a big problem in the community.
Yeah, and people, you know, people love, they love like feel-good things. So like if you can sneak health in a feel-good kind of way, like with recipes.
Healthy recipes.
I was even thinking about that with your question about the team services at health. I was wondering, like, there might be some way that you can slip that into like another program or a volunteering opportunity somehow, because it's really relevant to everyone in all age groups, but sometimes it's hard to convince people that they need to know about it.
The other thing which we found was often asked was exercise. You know, so it all ties in with diabetes, exercise. I mean, it's one big thing constantly. So you know, if you're doing work for something else, you find a brochure on exercise, just slip it in. You know, it helps.
Okay, any other questions as we conclude? Katrina?
I was curious, as you talked about getting out in like the community and the, you know, the area or adjoining towns. I know St. Peter's and Robert Wood Johnson have participated in Rutgers Day. Have you guys been invited to participate?
We have. We've been to Rutgers Day. Yeah.
That seems like a great way to get,
Yeah.
you know, a lot of people aware of what you're doing.
But actually, it's funny, you also mentioned St. Peter's. I did have a slide that they actually called us, and they've come out a few times to the library to do health screenings in the lobby of our library, diabetes, glucose, and
Somebody coming to the senior center to talk.
yeah,
also,
and they did that, so that's another partnership. Yeah, but we've gone to Rutgers Day, and you know, I can't stress enough the importance of believe in the library. If you just stay in your library, nobody's going to know what you do. You will have no relevance to the community at all, and then you know, you're just going to be subject to budget cuts and information now. Unlike when I was, you know, your age, there's a lot of competition. There's a lot of places that people can get information. But the reason they like libraries is because we're free, but also we're nice. You know, they really feel comfortable. They feel like they own it. You know, like they pay taxes. It's a welcoming place for them. And if you don't work really hard to create that aura of welcomeness, bless you, it's going to reflect in your salaries. It's going to drive down salaries. It's going to put jobs at risk. Make sure you sell yourself constantly and don't stop, bless you, in every capacity. It doesn't have to be health. It could be any kind of, like my friend Jones, phenomenal in business. Okay, other libraries everywhere are finding niches. And evaluate your community. You know, I mean, every community has health needs, but other communities have like more found homelessness. You know, that's like an untapped area.
I think in short, make yourself indispensable as much as you can to the township, and that is the only way that in the modern world to survive.
But it's
Because
very
budgets are being slashed everywhere, you know, so you have to.
But you know what? It's very rewarding when you hear the mayor talk about your program, because it's a big. That's what you want. You want your mayor and your town council. You know what? Invite your town council in to your library. Give them a tour. Tell them about the things that you're doing for business, for health, for teen health, for teen, teen programs, your Geek League, whatever. Let them know what you're doing. Sell yourself. And that's going to really translate for you into a highly successful career. And even a web developer, you know what I mean? Even tech people have to be able to be seen in the community and interact with people. So, we don't live on an island. It's a lot easier when I was in libraries. But now you can't hide anymore. But anyway, listen, I gave you all a copy of the brochure. You can read about our brochure. It's basically the same. One of them is with the hospital, because anytime you go out with the hospital, you have to use the hospital logo. And Charles, where were those bags?
They're right behind you. They're underneath the screen.
And I brought in Robert Wood Johnson bags as a
thank you.
bag.
They brought them because they're nice.
That's right, because they're librarians. And when we go out on health visits, we'll build these with some little handouts, some like nutrition, like something fun, informative.
But not candy.
Handy. But when we had the medical students, we were trying to decide what we should have on the table, so we really did fruit. Like apples and clementines. But thank you, everyone.
Yes, let's thank our guests.